everybody. Thank you for tuning in. It's the Morning Rush on Z1063. Hit music now. Danny Golden here, hanging out with somebody super cool, super smart, super caring, because you have to be that way when you're a doctor, right? It's Dr. Martin Rutherford, and he's here with me today. Thank you for joining me, sir.
Thank you, Danny.
Yeah, so we're talking about healing, and we're having this conversation. Before we went to break, I kind of left you guys on a high note. We were talking about getting poked, and I said that to lead into talking about acupuncture, because that's really, what it is. And before we went to break, you kind of started to explain exactly what the technical procedure for acupuncture is. But can you kind of delve in a little bit more on what exactly happens and what to expect when you get an acupuncture treatment?
Sure. Well, the overall process is you typically come in, we say hi, we bring you into a room, and we get you comfortable.
Okay.
We'll take a look at your pulses, we'll look at your tongue, we'll have a number of questions for you related to what it is you're seeking care for.
Okay.
And then we will develop a point prescription, which involves acupuncture, maybe cupping, like Phelps.
Oh, yes.
For Olympic stuff, or,
Yeah.
and also including herbs.
Oh, cool.
And then you get to lay on the table, relax, sleep if you can for 30 minutes.
Beautiful.
And then when you come off, a lot of people report a profound sense of relaxation.
Yeah.
And I would go so far as to say it's actually centering. It's not just relaxing, it's centering.
Well, because a lot of times some of the conditions that people are experiencing are directly linked to stress and lifestyle. And so honestly, before you even get to poking somebody, just to have them say, hey, sit the hell down, rest a little bit, take a load off and just chill for a second, that probably helps a whole lot. And then you get into, the techniques that you just mentioned, like the acupuncture and the cupping, and that's treating the actual condition, right?
Correct. Yeah. So different techniques are useful for different conditions. My particular approach or style of acupuncture would be termed as a Chinese style.
Okay.
And I do distal needling. That means the limbs from the elbows down and from the knees down.
Okay.
Occasionally on the face and the head.
Okay. Depending on, I would imagine, like, if I'm getting poked in my face or my head, is that like for migraines and different things like that, or where does that come in?
Well, one of my most recent patients is dealing with a cyst immediately under the cheekbone, which is impinging on a nerve, and it causes a headache on the backside of the head.
Oh no! So you just get to see all kind of fun conditions,
all kinds of things. Things sometimes that the Western side doesn't really have a diagnosis for.
Yeah, they just want to cut you open and feed you a bunch of pills sometimes, and that's not necessarily. Obviously, there are some things where for pain, for some people, and they want some immediate relief. But like you said, getting to the root cause of the pain, the root cause of the condition, I can't imagine a better way to treat something or someone.
Indeed, and one of the most powerful approaches to this is actually concurrently treating both Western and Eastern at the same time.
Absolutely. Okay, so they don't have to ditch their normal doctor.
Correct.
They can stick with
That's
Dr.
right.
Joe, and then they can come see Doc Martin as well. Well, you guys heard it here. We're going to have more talk about healing with Doc Martin from Better Healing, so stick around. It's the Morning Rush on Z1063. Hit music now.